Hello, my name is Tristan Jones, and this is my genetic disorder presentation on Huntington's disease. As mentioned previously, I am presenting on Huntington's disease. Huntington's disease affects an estimated 300 to 3,000 people in the US annually. More specifically, it affects 3 to 7 per 100,000 people of European descent and significantly less in other ethnicities. It is also known in the medical world as Huntington chorea. Huntington's disease is an inherited condition, and it affects the autosomal chromosomes, more specifically chromosome number 4. And it does so in a dominant manner, manifesting itself in adulthood. Huntington's disease is caused by mutations in the HTT gene in chromosome 4. The HTT gene functions as the instruction provider for the protein known as huntingtin. The huntingtin protein plays an undiscovered yet extremely vital role in neurological function, specifically in neuron cells. The HTT mutation elongates the DNA segment known as CAG trinucleotide repeat and multiplies the length of CAG trinucleotide repeat by 3 to 4 times what it normally is. This, in turn, elongates the huntingtin protein and disrupts the function of the neuron cell, ultimately killing it. On the left is a karyotype of 2 patients with Huntington's disease. In comparison, to show off Huntington's disease, both Huntington disease inflicted patients have homologous chromosomes of regular patients in comparison right next to it. On the right in the figure, you can see the afflicted individual's chromosome 4 with Huntington's disease compared to a normal patient's regular chromosome 4 on the left. In the right figure, we have a simple 3D rendering of Huntington disease effects on chromosome 4, the HTT gene, and the huntingtin protein. Symptoms include, but are not limited to, chorea, which is the violent and involuntary movement which happens frequently, hyperreflexia, which is overactive stretch reflex in muscles, bradykinesia, which is the slowness of movement, which might be aptly named after Tom Brady, who knows, dystonia, which manifests itself in fixed abnormal posture in the afflicted individual, and mental deterioration, which mostly shows itself in just overall cognitive decline. These symptoms all relate to the genetic and molecular problems in the sense that all of them are explained by the HTT gene's mutation, altering the huntingtin protein, which leads to the death of neurons and consequently affects neurological function. No real treatment exists to fully stop or cure Huntington's disease since its adult onset. However, certain medications may help alleviate the symptoms, but it only helps minorly with the erratic movement and the psychological deficiencies. Interventions with the patients are most effective, and these can be done with friends, family, and doctors, and it helps the individual adapt to the disease. This is my works cited. Thank you for watching.